Hi everyone, and welcome back to our channel. If you're here, you may be facing the difficult decision of whether home health care is the right option for your aging parents. While some seniors are fortunate enough to maintain their independence and live well into their later years, others may face difficulties earlier, requiring additional assistance to ensure their safety and well-being. It can be a tough transition, but today, we're breaking it all down for you. Why it may be necessary, the challenges involved, and how to navigate the process smoothly for both you and your loved one. So, let's dive in. As our loved ones grow older, it's natural for them to experience changes in their physical and mental health. These changes often make daily tasks more complex, affecting their ability to manage them independently. Oftentimes these signs and changes of your parent getting old are not always obvious, and it's easy to overlook the subtle changes that indicate a need for home healthcare support. My dad passed away when I was 35 years old. He suffered many ailing conditions, but I always had in the back of my mind he would always be here with me physically. I never looked at my father and thought for one moment that he wouldn't be here with me as I reach my senior years. Even with all that he went through health-wise, being a recipient of a kidney and surviving many years later, I just always thought he would be here. He was the laughing, dancing and joking dad that seemed not to have a care in the world. However, my world stopped in 2012 when his condition worsened after decades of having a kidney transplant and progression to stage 5 kidney disease without me even knowing. By this time it was too late for me to even understand or research home health care. I say this to help you look at the little signs and all contributing factors that could signal for your parent to obtain home health care services. I have come to realize in certain cultures and backgrounds many times health is not discussed amongst children, making it difficult to gauge what our parents may need. I wish I would have been more involved with my dad's trips to the doctor's office and understood the proper care for eating healthy, exercising and medications well after his transplant. I hope these key reasons will help you with deciding why home health care may become necessary. I listed a couple for your review. Aging often leads to physical limitations in eyesight, balance, strength, and agility. If you see your aging parent holding onto furniture while moving about the house, it may be time to research home health services. They can assist with mobility issues, chronic conditions, and post-hospital recovery assistance with walking, bathing, or other daily activities. If your parent has stopped participating in social activities they once enjoyed or seems withdrawn, this could be a sign of depression or cognitive decline. Alzheimer's, dementia, or general forgetfulness can pose safety risks. If you do see signs of health problems, seek local medical professionals as well as look into assisted living centers for your parents' safety, health, and well-being. Managing medications can be complex and overwhelming for elderly parents, especially if they have multiple prescriptions and missing doses. In addition, taking incorrect amounts can lead to serious health complications. If you notice that your parent is forgetting to take medication or taking incorrect doses, they may need assistance. Home care providers can help organize medications, set reminders, and ensure that they are taking the correct dosages, reducing the risk of medication-related issues. Another factor is often isolation and loneliness, which are common issues for aging adults, especially if they've lost friends, stopped driving, or moved to a new location. Some aging adults living alone may struggle with mental health due to a lack of social engagement. Home healthcare services can help by offering companionship and social interaction, which is crucial for maintaining mental and emotional well-being. Please never rule out caregiver burnout, as it is a common issue, often triggered by the constant demands of providing care and the emotional strain of watching your parents' health decline. Family caregivers may feel overwhelmed, balancing work, personal life, and caregiving responsibilities. As people age, they are more likely to experience several conditions at the same time. There may be other signs not listed, so it is always important to seek medical advice if you see anything of concern. One of the benefits of home care is that it can be customized to meet your parents' needs. Whether they need help for a few hours a day or around the clock, options are available for bathing, cooking, and cleaning and other needs. Now, let's talk about the challenges families face when considering home health care. It's not always a smooth process, and these hurdles can make the transition difficult. First, many aging adults fear losing their independence and privacy. They may resist help, believing they can manage on their own. Next, services can be expensive, especially if specialized medical care is needed. Insurance coverage varies, making financial planning crucial. The overall cost will be based on the type of care required, whether it's basic assistance with daily living activities or more complex medical care. Also, where you live will have an impact on the cost, with some states having significantly higher rates than others. Upon some research, I saw that the general average for the hourly rate can range from $20 to $40 depending on the services provided and location. It is good to acknowledge that the service of care is not always offered with each home health service. Be sure to research and vet agencies to ensure you choose the right company for your parents' needs. I would recommend researching your top 5 to 7 companies, then take the time to screen each in-home care provider carefully. You want to find not only the right agency, but people who you feel comfortable having in your home and assisting your loved one. It may be beneficial to create a list of care needs, as well as any expectations for days and hours assistance is needed, the financial component, and any other questions you and your family may have. Finally, time management for family caregivers. Coordinating care, attending doctor visits, and managing household responsibilities can be overwhelming. Bringing in professional caregivers can relieve some of this strain, allowing family members to focus on their own well-being while ensuring their parent receives the care they need. Never think it is selfish to seek help, it's essential for everyone involved. The aging process is difficult for everyone, but it can be much easier if we know we are not in it alone. Be aware of the issues and signs related to aging, and make sure to give your parents the proper assistance they need. If you do see signs of health problems, seek local medical professionals as well as look into assisted living centers for your parents if needed. So, how do we address these concerns? Have a family meeting to determine what are your parents' biggest concerns about receiving home health care. Also determine what are the financial implications of home health care. Have open and honest communication asking your parents, how can you best address their fears and anxieties about losing independence or privacy? Involve your parents in the decision-making process. Explain that home health care can actually preserve their independence by helping them manage daily tasks and stay in their own home longer. Emphasize that you are seeking support together and that you'll be involved every step of the way. Even with professional caregivers, family support remains crucial. Here are ways you can help your parents maintain a healthy and fulfilling lifestyle. First, participate in their care. Stay involved by checking in with caregivers, monitoring their well-being, and helping with scheduling appointments. Second, encourage social engagement. Arrange video calls with relatives, take your parents on short outings, or involve them in community activities. Encourage your parents to participate in activities they enjoy, whether it's joining a senior center, pursuing hobbies, or spending time with friends. Combating social isolation is crucial for their well-being. Third, support their mental and emotional health. Encourage hobbies, introduce them to music, puzzles, or books, and ensure they feel valued and heard. As always, don't forget to look at some local resources to help aging parents and caregivers manage home health care effectively. Don't hesitate to contact your local area agency on aging for guidance on financial assistance programs. Be sure to research different options, including Medicare, Medicaid, and long-term care insurance. Explore payment plans and consider the financial implications carefully. Here are some great options to consider when you begin your research. AARP Caregiving Resource Center. AARP provides expert advice and community support. Eldercare Locator helps connect families to local support services. And National Council on Aging or NCOA provides information and advocacy on issues affecting older adults. Each website link has been provided in the description. Utilizing home health care services can be a positive and empowering experience for both your parents and your family. By understanding the challenges, communicating openly, and utilizing available resources, you can ensure your aging parents receive the support they need to live healthy, fulfilling lives for safety, health, and happiness, while also giving family caregivers the support they need. This is a journey filled with love and unforgettable memories to help you maneuver through this phase of life. If you found this video helpful, be sure to like, subscribe, and share it with someone who may need this guidance. And remember, you're not alone in this journey. Until next time, take care.